should have lunch here.
Go ahead.
Good afternoon. Welcome to Sarasota Memorial Hospital and Breathe Easy. And Brodika and I are glad you're joining us today. And we're going to be talking about an interesting topic this time of year. Next week becomes spring. And with spring comes allergens and triggers. And we're going to talk a little bit about triggers. We have a live audience here today to join us. You might have some questions to join some other questions. And just have a nice discussion today. And with that in mind, you have the trigger here? Go ahead. The trigger for the triggers. Okay, we're going to get it started here. Okay.
So today we are going to discuss the importance of avoiding triggers such as allergies and irritants to our breathing, the importance of renewal and finding ourselves again as we are patients suffering from COPD, and the appreciation of rediscovery, choosing who we will be our COPD. So, avoiding triggers, allergen and irritants, it means you usually we hear often in the clinic that patients with COPD and asthma complain about airway sensitivity to allergens and irritants. But what are the allergens and irritants? These are small particles that exist in the air we breathe, causing the airway to be sensitive to. So, but what is the difference between an allergen and an irritant? Allergens are small particles that when breathing in cause an allergic reaction, meaning the airway becomes swollen and there is an increased production of mucus. Who are they? So we can avoid them. Allergens are pollen, dust mites, pet dander, mold, dirty or wet rugs or carpets. Not every patient with COPD has allergies, but any of us suffering from COPD or not, we should avoid these allergens because, as I mentioned before, they cause more swelling of the airways, so the airways they're getting narrower and narrower, so it's hard for the air to get in and get out. And because there is an increased production of mucus, that is going to cause even more difficult. Breathing is going to be even more difficult. What happens when our body encounters an allergen, starts producing histamine. And in order to block or reduce the production of histamine, we can take some medications over the counter called antihistamines, right? Such as Claritin, such as Zyrtec. These are over the counter, just to diminish the symptoms and treat the symptoms triggered by these allergens. But what are the irritants now? Irritants are small particles that what they do, exactly what they say, they cause irritation of the airway. If not every patient with COPD or asthma may have allergies and allergic reaction to allergens, well, just about everybody with COPD and asthma may be very sensitive to irritants. But who are the irritants? Tobacco smoke, pesticides, chemicals, over-scented soaps and deodorants. These are irritants. Air pollution is an irritant. So we can avoid them. We have to stay away from them as much as possible. How do we do that? Like simple hygiene is first. Let's wash our rugs and dirty carpets more often. Avoid getting outside when the season is such as now, when the pollen is everywhere. Try to stay more inside, and if you have to go outside, probably the best thing is to go early morning or late night. Have your windows at your car closed at all times, and need be, just wear a mask. What do you think about air pollution? How do we check that valve?
The American Lung Association has a site every day that you can go online for air pollution control to see what's going on in the environment. They're a very good site. Just to go online to the American Lung Association, and they have a site that will keep you posted. And one of the things I was just going to add in terms of environmental, altitude, because a lot of times we're traveling. And you need to be aware that altitude in the environment can also be a challenge, a trigger to difficulty breathing as well. And the other one that goes right along with that, especially in our seasons, is temperature changes. We have the benefit here on the west coast of Florida to be fairly air pollution free, but we do have these triggers of the pollens and all the ragweeds and the pollutants in terms of the allergens, but it's usually later in the year that we have to watch out here in Florida, like in July and August. We get these temperature and humidity challenges as well that also might mean I need to stay indoors a little bit more.
As you mentioned, humidity, a dehumidifier would be a great idea. Changing the filters in the air conditioning system would be another great idea. Mold is a big enemy, it's an allergen. So having someone checking the house for mold, especially in the very wet areas, such as the kitchen and the bathroom, would be really a must, especially when suffering with asthma or COPD. Because any trigger will cause an exacerbation or worsening of the symptoms. And it's better to prevent any of this instead of, having to go to the doctors or even go to the hospital and treat an exacerbation of COPD.
Another trigger that comes to mind many times is we might barbecue, and that can also create a challenge in terms of the exposure to the chemicals in barbecuing here in Southwest Florida. And then if we travel and we go up north and we enjoy that nice warm wood-burning stove, that can also play havoc with airways. So we want to be aware of that as well.
Exactly. So having fireplaces indoors and the wood stoves, just make sure they're well ventilated. So we don't inhale or we're not coming in touch with those particles coming from the wood stove or the fireplace. Do you have a...
I think, any questions about irritants or allergies before we go to the next area of renewal?
Right.
Yeah, we're trying to find a good number for Joey perhaps.
Okay. Yes, sir.
I just might mention on altitude.
Yes.
Learning the hard way. When you're flying, they pressurize, they say you're 5,500 foot.
Mm-hmm.
But some plane, the plane I was on, they said only 7,500 foot, which was, I was dealing with it, but it also makes you go through your batteries much quicker than you're expecting. Because you're concentrating less dense air.
Well, that's a really good point for people traveling with oxygen to be more aware of the cabin pressures and make sure that your battery is going to sustain that
I ran out
pressurization.
about 40 minutes from Phoenix. It worked out, but you want to be aware of it.
Right. That's a very good point. Thank you.
As a matter of fact, take into consideration that we have so many patients here that are visiting or are staying in Sarasota just for the season. We're going to have in May another support group called Traveling with COPD. So it's so very welcome to join us for that interesting discussion. Whether we travel in the United States, we travel by car, by train, or by airplane, I think it's going to be an interesting discussion to have.
Is that here at the hospital?
Yes, right here.
Too much down the road. Okay. All right. Want to talk about next area?
Renewal, finding ourselves again.
Okay.
Steps to awareness.
I think that the quote here,
Yes.
as patients with COPD, sometimes we need to appreciate that sometimes we just need to step back and say, hey, look, I know I have a lung condition, but I just need to give myself the freedom to adjust to the fact that I might have this condition or any other condition, but with the grace of God and staying calm, not caving in to the circumstance of the condition. Renewal is all we're saying here is that I'm facing up to my condition with courage and strength, because a lot of times we can have, I don't know about you, but it doesn't take much sometimes on a bad day to just get me to say, wow, woe is me. I just want to throw in the towel. But I just want to encourage you, don't. You know, because the bottom line is, you're not alone. You have providers like here in our community, in our hospital. You also have providers in your group, in your community of friends and family who are there for you. I just want to encourage you just to step up and remember there's nothing that you're not dealing with that millions of other people right now are dealing with the same type of situation. And that renewal is just a call to, hey, don't give up, face up to the situation, and I'm going to take the next step.
As we all know, moving and cycling to different stages of COPD, moving into different stages of COPD, we have different challenges, and patients with COPD are so much aware of them. There's so much about their disease. And everybody understands at one point, this is not a sentence, this is not nothing else except a journey, as it is for all of us. But it is a different journey because we have this diagnosis, we have this condition, and we have to understand, and we have to be the ones managing the disease and not allowing the disease to manage us. So consider it as a journey, as a pathway, and as a way of discovering life every day. As we mentioned in our previous discussions, John Tucker was a great example of that. She was in her 50s when she was diagnosed with COPD, and she was told that she has just a few years to live. And she made the best of those years. Actually, she lived much longer. I think this is the message. Just take every day as an amazing gift, as all of us should, and to make the best of it.
It doesn't have to be overwhelming at all, because when you think about it, whether I'm mild severity, moderate severity, or severe severity, there's no reason that I can't take the time to relax and really use the basic tools we're all given to, as long as I stay calm, that's half the battle. And if I can avoid anxiety and pain, I call that panic cycle, of I get to the point where I'm going to breathe faster and deeper. And if I breathe faster and deeper with this particular condition, I'm defeating myself. I need to stay calm. Use our breathing techniques in terms of pursed-lip breathing, relaxing, and using that monitor that you need to have too of yourself, knowing yourself of when you're having a good day or a bad day, and also using tools, for instance, a pulse oximeter, to give my feedback of, hey, when I am in charge and calming down and breathing well, I'm going to see my oxygen levels improve, my heart rate go down, and I'm back in charge of my breathing, and that renewed focus is what got me there. Just remember, I'm not going to cave in.
With COPD, being a journey, also has those challenges, as you mentioned, having anxiety and having depression and having good days and bad days, and knowing how to navigate this cycle, it's so important. Just learning the triggers, what triggers for each patient an exacerbation is paramount. We need to know that we are unique. You are unique in this journey, and what makes your day better or makes your day worse, it's so much up to you. If you learn how to pace yourself, do the most important activities in the morning when you have the highest energy, and just take frequent breaks. Take frequent breaks and recover that energy, conserve that energy. That is paramount. As I said previously, having a good day, it's wonderful. Make sure the next day you have another good day, meaning you pace yourself the same way you paced the day before. And after you have 2 or 3 good days, then you can increase your activity level.
I just want to throw one other comment. Sometimes what affects my perception of my symptoms and my good days and bad days is my attitude and my emotions. And I just want to mention that because I think a lot of times our emotions can fool us. I can have a friend or a family or a significant person in my life, some event happen that really affects me emotionally, that can trigger how I'm feeling about myself. And the reason I'm mentioning this is that if we don't stop and take that perspective in mind, I might be reacting or overreacting or underreacting to my symptoms. I just want to, the group I think of is years ago in my training in Southern California, I dealt with a lot of asthma patients, pediatric asthma patients. And when they're a very close group, and when one person in that group really had a downslide, it affected others in the group. And that can happen with COPD as well. And I think it's sort of like the triggers. It's being aware of those emotions and factors that trigger those emotions as well, because there is a relationship in their hormonal and humoral responses in our body of histamine's relief due to emotions as well. I just want to mention that.
And it is, I think, advisable to tell your family members and loved ones that you are not having a very good day, and what is it exactly what you're expecting, are you expecting from them. This way they can help and they can understand, and I think they will appreciate you being so open and telling them it's not a good day, and what is the best way to get through the day and make sure the following day is going to be much better.
And like we mentioned last month along that same line, is that by that awareness that we're sharing, that also helps our loved ones who are trying to be supportive to be aware of where I'm at that moment. Sometimes we all just need chill out moments in times. I need my space. Or I need you to understand what I'm feeling physically, so that emotionally you'll know why I might not be able to meet that emotional need or meet that physical expectation, whatever it is. Because sometimes there's no way, unless someone tells me you're feeling this way, that I can't adjust my expectation. And so many times there's just that misunderstanding of where we're at. I just want to mention it.
It is also another great idea to follow up as frequently as you can and advisable with your providers. If you can have a discussion as different types of COPD have different manifestations and they feel differently. Sometimes a need of medications will make a big difference. Sometimes having oxygen on will make a big difference. And having that discussion with your provider is really paramount.
And kind of ties into, with some of you we've met in support groups, and some of you we've met in the clinic, but just to reinforce, one of the tools that helps you in communicating with your provider is a simple tool called the CAT, that COPD assessment test of that inventory of how I'm doing. Some type of measurement that gives you a tracking might also be helpful there in terms of how I'm doing.
So indeed, we may be limited, but we're not emotionally handicapped. That's for sure. I think when it comes to emotions, living a life of COPD with asthma or any chronic diseases if anything else, it's going to make us more emotionally mature and able to cope with so many challenges that we never thought before that we're going to have, or we're going to be able to cope with.
The next one, rediscovery, is that next step after renewal, okay? That's kind of taking charge, okay? We're saying that now that we know who we are with our condition, what we're going to do is make sure that we're not limited emotionally and handicapped in any way. I just want to make sure that we feel confident that I am in charge, not my technology, not my inhaler, not my nebulizer, not my oxygen. I'm in charge, and I'm not going to be handicapped. And one of the things that I keep in mind here is that by determining who I want to be on this journey, I want to have some goals. You know, what do I want to be doing 3 months from now? Is there a graduation, a wedding, an event in our family life that we want to shoot for? Or I want to take that train that goes from Chicago to the Northwest. You know, I want to do something that I haven't seen before. Put some goals out there that you say, I want to do this no matter what, and let's take the steps to plan for it. It might be, I need to get into pulmonary rehab. And I'm going to get into pulmonary rehab, and I'm going to successfully complete pulmonary rehab. Well, after that goal, while I'm doing that, there's some things I could be enjoying my personal life because I'm getting stronger, I'm taking charge. And along that same line is, I'm going to graduate from pulmonary rehab. Okay? Well, what do I want to do? I need to make sure I'm involved in a support group. Well, you know, Radhika and Bob were talking about this monthly together at Sarasota Memorial, as well as our online opportunities that are available too. I just want you encouraged to look beyond where you're at. I had an opportunity for a number of years to help patients when they were leaving the hospital and going home to stay out of the hospital in a role called a transitions coach role. And one of the things I saw many times is that if you get caught in your little circle of 4x4, I have my oxygen, my TV remote, and I'm set. That is one of the most debilitating prisons that you can be in, because you're not in charge for anything but what's right here. Well, I want to go beyond that. I want to go beyond to, hey, what are the things that are really meaningful in that dash in my life? That time that I have on this earth. What I want to do. When I say dash, I'm saying I came in this world this date, I'm leaving this world that date. That dash is what's in between. What do I want to do during this dash to make life enjoyable and to care for my life and those I affect around me? Because when you're taking charge, you're encouraging the people around you too. Because when you're taking charge, you're saying, wow, Radhika said she wants to do this next month. Then I'm going to plan to do this to help her do it. And let's work together to get it done. And I just want to encourage you with it. Not only renewal, but with discovery and moving on to the next step.
Absolutely. And this kind of ties into our next topic for next month, which is going to be pulmonary rehab, exercise, physical activity, being more the most active with pulmonary diseases, COPD and asthma. As you mentioned, it's so important to be active. Not sitting around, even though it's so difficult. Now you go like, oh, I can barely catch my breath. Then we need to see, why is that? How can we help? What should we change? What are the steps that we need to take, and the actions we need to take to make your breathing better so you can enjoy an active life. You can move around easier. Because activity is life, and you feel much better when you have this freedom to move around and you are not bound to your couch or to your chair or even worse, to your bed.
One of the things that reminds me of too is that studies now are showing what really makes a difference in people's lives. And really, when you look at all the different tools of medications, oxygen, exercise, activity. The real key one is the one that you just mentioned, activity. If you're staying active, you're more successful in your life. And to do that, you need to line up those other pieces of the exercise, the pulmonary rehab, medication, oxygen, which are appropriate for your needs at your part of the journey. Everybody's different. Everybody's got a different story. Everybody's got different mixes of conditions. One of the things we see a lot of is that on an average, people with COPD have about half a dozen other conditions. So you're balancing your different needs. And it's very important to focus on what your needs are. We're not cookie cut. In fact, we're very unique. I think Ancestry.com and 23andMe and a lot of these other organizations that are helping us understand our makeup and our history are helping us appreciate that uniqueness. And I just want to encourage you to take that step of taking charge and balance. Yes, COPD is a major thing that you need to deal with, but if you do a well job of managing this condition, guess what? Those other conditions are going to fall along too.
Definitely, and it would be a great thing to have the support group with more patients where everybody can kind of share their experience, because we are so unique, and each experience is amazing, and sharing that may help somebody else's journey, and may help also find new solutions, new ideas on how to live a better life with COPD.
I think we have some questions and answers that we wanted to start with.
So today we discussed avoiding the triggers. We discussed about allergens and irritants. We should stay away from them, and we heard some tips how we should avoid them in order to avoid an exacerbation of symptoms. We talked about renewal, finding ourselves and living a good life with COPD, and also rediscovery, taking charge of our living with COPD. As we said, next month we're going to talk about breathing and taking a deep breath. It's going to be about pulmonary rehab and physical activity and exercise. I think it's going to be very exciting because we're going to have a guest speaker, our respiratory therapist,
Deborah North.
Yes, Deborah North, and she is a pulmonary rehab specialist.
Right.
It would be really interesting to have her here, and we're looking forward to your presence as well.
One of the things I like to do is just ask, especially in the area of avoiding triggers, are there any other questions or comments people would like to bring forth at this point? Because we've just kind of introduced the surface of everything, but we would like this to be a two-way dialogue. If there's any things that we can help promote discussion, I would love to.
I have a question on the triggers.
Sure.
I've heard that you get more sensitive the more times you've had exacerbations with the triggers or whatever. At different periods, I get where I'm very, very sensitive to in-dust spray about anything. But do you actually get more sensitive? The other day, I don't deal with pool chemicals or anything anymore at all. But I had my sister-in-law was putting some acid in the pool, and I was out and I was fine. But then I got a sensation of fumes, and I just got away from that. But she was kind of exasperated. She said she hadn't opened the cap or even popped the seal on it yet, so I couldn't be sensitive. I didn't know whether I was anticipating and making my, creating the feel, or you get like one of those sniffer dogs actually get sensitized to where I noticed I won't even go in a pool store, even though everything's closed. It seems to get me, or maybe it's just all the plastic bottles. But do you get more sensitive? Is that an actual thing, or is it me more expecting to have a reaction and causing the reaction myself?
Yeah, what are your thoughts, Rebecca?
No, definitely stay away from any irritants.
Oh, yeah.
Absolutely, it's not you. We highly recommend, have somebody clean your house. do not use chemicals unless there are some natural products. Do not use them, regardless of your COPD stage. Have somebody helping with all those things. Replace everything that will be an irritant to you with something that is mild, it's not going to trigger any allergic reaction or any irritation. So no, you're absolutely right. Don't be even close to that.
I've done that for years. Do you get more sensitive? Is that a real
You know,
thing?
I think that as COPD progresses, you have more narrowing of the airways. So of course you can react.
So you feel a small change.
And I think